number one question people ask me, and Ashley asked me, was, are these symptoms all hormone related? And the answer is yes. I wanted to share the story of Ashley, who is one of the most recent people to join my hormone masterclass. And I think her story really encompasses, it rings true for so many people, with some of her challenges, and some of the problems, and some of the frustrations she had around her health. So Ashley, I met her literally a couple weeks ago, and here's her story. She's a young mother with postpartum. She said, a nightmare of symptoms for her. It's caused her not to ever want to get pregnant again. She developed quite a few symptoms. She's had a history of lumbar scoliosis. She's had difficult to lose weight since she was postpartum, and immense chronic pain in her hip area, right? And her husband gives her deep tissue massages. She does bar, and she does Pilates and chiropractic care. She takes CBD creams, and she has been breastfeeding as well. And so she's wondering, what's going to be safe for me to take during breastfeeding? She's gone up to her doctors because she has low thyroid, and she's been having tons of her thyroid medications adjusted, yet she's still gaining weight, feeling like shit with pain. And now she's been dealing with symptoms most recently of being really dizzy. She has tremors, she's lightheaded, and she has low blood pressure. And she's starting to think she might have something called POTS, postural orthostatic tachycardia syndrome. This is symptom stacking more and more. And then worst off on top of it, she's now developed, as a result of having all these episodes where she nearly faints all the time with her heart running really fast and her blood pressure dropping, she's developed severe anxiety with panic attack, and which is now turning into depression. So this is, to me, Ashley is a classic example of someone that would present into my hormone masterclass, because there's a lot of different symptoms that are going on. We're not dealing with just, postpartum. That's the first hint that we're dealing with a hormone imbalance. But then there's all this scoliosis, lumbar pain, hip pain on top of it, history of low thyroid, which, by the way, is already a hormonal disorder, right? Thyroid is also hormones. So we have not just your thyroid that makes hormones, we got adrenals that make hormones, and we got your sex hormones, and they're all working together. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform Protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. So this is a lady who she's being seen by her obstetrician for her postpartum care. She's being seen by her primary care doctor for her thyroid, and she's feeling worse and worse and worse, to the point she's now developed cardiovascular symptoms. So classic case. And number one question people ask me, and Ashley asked me, was, are these symptoms all hormone related? And the answer is yes. They are. And her dizziness, tremors, lightheadedness, low blood pressure got a lot worse when it actually started postpartum. So that big drop in hormones after she delivers her baby and the placenta, that it really triggered the onset of cardiovascular symptoms. And she's going to the cardiologist and trying to figure out what's wrong. And those tests are going to be all negative. I can already tell you, because I've seen 1,000 Ashleys, just probably in the last 3 years alone. So people will go to all these specialists, whether it's to the neurologist, to the gynecologist, to the cardiologist, and they're going to be saying nothing is wrong. And here's what I found out when we, in our intensive, when we went over these results together, we found out that she had hidden PCOS, polycystic ovarian syndrome. None of her doctors ever tested her hormones. And even when she showed these hormones to her medical providers, they didn't know what she was talking about. And yet, when we went back, and once she had a diagnosis of hidden PCOS, she went back to her whole medical history, all these things started to make sense. And there's a lot of training in my hormone masterclass around this pattern I call hidden PCOS, which is not obvious to medical providers. In fact, I'm the only doctor I know that teaches this pattern and understands the health implications of that. Because then it came on, I was like, well, if someone has PCOS, that means that they're very high likely to have terrible blood sugar problems, which means they're at much higher risk for gestational diabetes and diabetes. She's like, oh, did I tell you I had gestational diabetes? Then I said, there's likely a family history of women who've had endometriosis, fibroids, or hysterectomies. Oh, did I tell you my mom had a hysterectomy, right? And then I said, because you have polycystic ovarian syndrome, It makes you more prone. It's not a testosterone problem. The biggest problem underneath is actually a blood sugar problem. And these ginormous blood sugar swings is the underlying root cause of POTS, the postural orthostatic tachycardia syndrome. So it's almost like boom, 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 boom. I love linking these things all together for people in my hormone masterclass. One of the biggest moments for me was when I looked at Ashley and I said, Ashley, you're right. You are right. And that was a really powerful moment I love being in that position to be able to affirm for someone that they were right all along about the role of hormones in their health and they're not crazy, especially with the panic, attack and the anxiety. A lot of people are writing her off, all the ER visits, right? I love being able to be the one to look at you and be like, you're right. You're so right, in fact, that you knew more even back then than any of your doctors combined. And now you have the science, the data, and the training to know just how right you are and what to do about it. So it was a really powerful moment for Ashley and I, and one of my greatest joy in providing my Hormone Masterclass, the program, to so many people. And it doesn't matter where you live. It doesn't matter even if you're global. You're able to access the program. We can ship the test kits anywhere and deliver the program anywhere that has internet access to almost every country around the globe. And so absolutely, this is my pride and joy. And Ashley just commented actually on our YouTube channel, and she was talking about how much this has really changed her life and really affirmed her own confidence in herself. And I will tell you that this whole quest for hormone balance, I would say my hidden agenda underneath it is for you to gain self-trust. If I could get 1 million people to learn about what are the root causes that are triggering whatever the health symptoms are, help them gain the confidence so that they have self-trust. That's what true mastery is about, is the quest for you to learn how to gain self-trust. There you go. Thank you for letting me share Ashley's story with you. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire, and that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click 2 of those and watch those 2 trainings. They're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.